Good evening and welcome to Face to Face for the Newsfirst team. I'm Niresh Aliathambi. I am delighted to welcome to our studio Professor Sally Hardy, Dean of the School of Health Sciences at the University of East Anglia, where she is also a professor of global health and healthcare systems, which is quite a distinguished...
Quite a big name badge.
Yes, it is. Welcome and good evening, Professor.
Thank you.
Right. So, Professor, you are here for a very specific event. That is, you are the chair of SOFTN, SOFTN, which is shaping our future through new coalitions. And that's a conference which has 125 delegates from 6 nations.
Yes.
And it is all about healthcare professionals and their care for themselves in order to
provide the best care for others.
Right. So
yes.
this is very interesting because we run to our healthcare professionals, doctors, midwives, nurses, for every little thing, from a heart attack down to just a tiny little blister, and we don't think very much about our healthcare professionals, the pressures, the stress that they are under, and the enormous responsibilities that they have.
And I think there's a very fast pace of change in healthcare at the moment. We've got a lot of digital technologies coming into the system. We've got a lot of new interventions and treatments that are making people live longer with many more complicated diseases. So the pressure on our healthcare services are very high. And yet we tend to rely on the workforce to keep bending, molding, becoming, they've got to be more resilient to deal with all of this change. So our approach is very much about putting an infrastructure of support around the carers. So the healthcare professionals who provide the care feel supported to make the best clinical decisions they can make and provide the best care for people they're living and working amongst. So our first day of the conference was very much about change starts with me. If I'm feeling stressed by my workplace environment, by my living conditions, by my relationships, that's going to have an impact when you come to work on your tolerance when someone is coming to you in a very vulnerable state. How capable are you of hearing their story and understanding what's going to work for them? So the quick reaction is, I've seen this before, let's do this. But it might not work for that person in their situation. So we're really trying to rethink the whole framework around our workforce as a significantly valuable resource that we need to look after in order to look after our population and our planet, because our planet is suffering as well, and that's having a knock-on effect on the health of our nations.
Now, Professor Sally, in a country like Sri Lanka,
yes,
where there are very few healthcare professionals when you take the population.
It's a population size, yes.
And that's due to a number of factors.
Yep.
But in such a situation, the healthcare professionals who are here are under tremendous pressure, aren't they?
They are. So day 2, that is the conference today has been day 2, we've moved to thinking about how ordinary people can do extraordinary things. So when as healthcare professionals you work alongside your patients, your population, your specialist interest group, they themselves start to come up with solutions that are right for them. So we heard just a few minutes ago of a community scientist project where the mothers are learning health promotion around nutrition, the first 1,000 days of a child's health and well-being, utilizing natural resources to boost food well-being, weight, rather than spending money on sugar, salt, using lots of oil. And they've educated themselves and have kept very detailed charts of how they've seen the children's birth rates, weights, sorry, not birth rates, children's development, both psychological development as well as physical development, improve over time. And they've kept beautiful data charts, and it was humbling, but it was also so inspiring that are we using our resources efficiently to not only deliver sustainable healthcare, but to allow people to live in their localities as well as they possibly can, utilizing the resources that are available. And I think for me, a couple of key messages is around nature heals, and yet we take nature for granted. And our bodies self-regulate and heal, and yet we take our bodies for granted. So we need to start thinking differently about how to utilize health in a very resource-starved environment that we're living and working in currently.
Right. So now, one factor which I always look at is in our healthcare system in Sri Lanka, which is a free healthcare system, people tend to take it for granted because they can go to a hospital without any payment at any time. So does that sort of lead to people just taking it for granted and taking their bodies for granted and not eating right, not cooking right, and not exercising, all the things that we should be doing? What's your experience in the UK, which also has generally a free
National Health Service?
Yes.
Yes. I think, like I said earlier, we're in such a fast-paced world at the moment that people look for the quickest solution, and we look for the quick fixes. So a lot of people are looking for how am I going to get help in the quickest way? So they will go to accident and emergency rather than thinking, what do I need to change about my health behaviours to improve my backache, my headache, my stress, my tensions. And so when care is available, like we said at the beginning, people will utilize what's there without necessarily thinking, can I start here with my health and well-being and how I can help myself and my family? They will go for quick solutions. And I think mobile phones, the internet, AI is not necessarily helping us, because still we're getting a quick fix. What do I do here? How do I do this? And I think accident and emergency does tend to be one of the busiest departments, doesn't it? Where people go for a quick fix rather than thinking, what's the long-term plan for me here? But then when we've had students come over to have a placement experience in Sri Lanka, in your beautiful country, they've gone home with a very different perspective on how the NHS has provided care, and like we said, unfortunately has potentially been under-resourced and overutilised in the wrong ways. So I think, yes, we fall into sort of a mechanical quick fix way of thinking about health, whereas our conference is much more softening our skill set to think about health and well-being in a very different way.
Right. And you mentioned that you have 6 nations in the conference.
Yes.
What are those nations?
So that has come about because over the years I've been very interested in global health and particularly mental well-being and how we understand the world in which we with which we live and how we form relationships with people. Some of those relationships are restorative, some of them are damaging. So I started doing some work in Sri Lanka probably 4 or 5 years ago now, where we were thinking about what the curriculum for healthcare professionals offered in terms of mental health awareness, stigma, how we understand health and well-being across the lifespan, and how our mental health changes over time. So we've been working here on the mental health program, and the conference was something we talked about in terms of we didn't just want to chat and talk and educate or teach. We wanted people to think differently and have actions and intentions to change their practice. And then the Caribbean partners are from Jamaica and Trinidad and Tobago, where again we've done some work and looked at maternal health challenges, and again fits very well with the work in Sri Lanka and what you're experiencing here in terms of birth weights and mothers' health and well-being if water and food are lacking. And then working with the United Arab Emirates in my role as Dean of Health, we visited partners at the University of Sharjah and talked about our leadership responsibilities and our political responsibilities in the research that we do. How do we make a difference? So that's been a long-term relationship as well. And then I worked in Australia for a couple of years, and so relationships there have continued. And again, Australia is a very big island compared to Sri Lanka or England or the Caribbean islands, still has areas of real isolation, deprivation, coastal rural communities that are really trying to find what systems work for them in the challenges that they're facing. So we've all come together with this shared vision of what can we do? How do we work in these new coalitions rather than doing individual projects here, there and everywhere? How do we pool that knowledge and share best practice and initiate change as a real sort of social movement?
Lovely. So, Professor Sally, tell us a little bit more about what you guys are discussing in the conference with 125 medical professionals, healthcare professionals from so many countries. It must be covering a wide gamut of areas.
So we've tried to organise the conference so that day one is about understanding self and how change starts within. And if we want a kinder society, we need to be kind to ourselves, and we need to show compassion to our healthcare providers because they're so vital to sustaining population health and well-being. Day two moves to understanding how, when we work with people rather than doing to, it can make a sustained impact on their living well, living for a long time well, within again their locality and the communities within which they live and work. And then day three moves to thinking about what's our leadership responsibility? How do we initiate change on a macro level where lessons learnt along the way can be implemented and utilised to ensure that our healthcare workforce are making the best clinical decisions for the people that they work with and work for.
Right. And who are the other stakeholders, apart from the healthcare professionals themselves? Who else needs to get involved in creating this better environment for the healthcare professionals?
Well, it was interesting today to see some young people coming and sharing the work they're doing in their local villages. And I think I'm coming towards the end of my career, so how do we inspire the next generation to have this way of thinking about their health and the well-being of their communities that they're going to live and work amongst? And I think it's also about the researchers, the academics who are investigating what works, for whom, how, and then how do we scale that with sensitivity to cultural needs and cultural diversity. Because you can have 50-year-old diabetics, but they're all going to have a slightly different experience of their diabetes. So you can't necessarily just pick and drop the same treatment pathway for those same 50 people. The richness of the work that we do is when we walk alongside people, understand what they need in their context, and they have choice about what's going to work for them. Because invariably we do have solutions within us if only we're given time and people listen and appreciate that, yes, you may know better than I do as the health professional about how your body functions and what's going to work for you. So it's a real process of working from we call it the micro, the sort of individual work, to the meso, the teams, the organisations, right out to the macro political systems and commissioners. So I think the beneficiaries of the conference are local communities, healthcare professionals, students. We have students at the conference that are so eager to learn and hear about what's going on in other countries. The researchers, like I've said, politicians, commissioners, it ripples out, doesn't it, when you've got something that saves money. Actually, the way that we work and the projects that we've delivered are showing return on investment, and we're seeing that.
Absolutely. And speaking of money, now there's been quite a controversy in Sri Lanka about the low level of investment in healthcare, because our priorities, our political priorities, seem to have been in other areas, but health and education have suffered through a very small budget, comparatively speaking. It is there are moves to increase it, there are targets set for the future and so on, but when you have a small budget for healthcare, what does that do to the healthcare professionals who, I mean, if they, well, there's 21 million people in Sri Lanka, that's our population, they still have to care for those 21 million people. So what does that do in terms of the pressure on healthcare professionals?
It's complicated, isn't it? Economics, and it's not particularly my subject of expertise, but I think we can look at it in a couple of different ways. It's about where are we investing our resources, and our healthcare workforce are a very valuable resource to population health. And if we are making work difficult for our practitioners to feel that they can make decisions within their scope of practice, within their area of clinical speciality, if they are permanently thinking, am I getting this wrong? Am I going to get told off? I better not do this. I haven't got permission. Their clinical decision making will shrink over time, and they will become more and more robotic almost in how they deliver care. And then at the other end of that sort of spectrum, shall we say, it makes us incredibly creative. It makes us think about how can we work around this in a way that we get the best care for our patients and our populations on minimal resources. So it's a sort of Jekyll and Hyde, or whatever. It's a dichotomy. Perhaps that's the word I'm looking for.
Right.
So on the one hand, yes, it's a struggle to always get the resources we need or want, but on the other hand, it makes us incredibly creative in terms of how do we problem solve here? How do I get the care for this patient in a way that's going to be right for them? And that's where the education, the working with, the walking alongside, finding out what's right for that person will over time bring back financial benefit.
Now, your speciality is mental health, but in a country like Sri Lanka, mental health is not prioritized. There's a lot of stigma surrounding it, whereas in more open Western societies, it's normal to go and see a counselor if you feel overwhelmed. So there's someone to talk to. But here in our type of culture, we tend to bottle things up, and then it has very adverse effects later on. How do you transform a culture into accepting that mental health is a very vital issue?
It's part of who we are, isn't it? We all have mental health. And again, a lot of our traditional ways of understanding the body separates the mind from the body. You have a separate sort of area of study in psychiatry, mental health, that you have to bodily systems. But I think we're beginning to put the head back on the body and understand that it's a symbiotic relationship. So if your mind is not right, your body feels it as well. And when you're in pain, you often are likely to get more anxious and depressed. So it's getting the balance right, isn't it? And I think it's about educating people to talk about mental health. So one of the things we've done in the mental health curriculum is to think about the stigma, the stereotypes, but also where does our cultural understanding of mental health come from? And often it's quite mythical. So these myths become part of our natural cultural way of understanding what we don't understand. So it makes sense to us to park mental health over here, try and ignore it, hopefully it will go away. But actually, the way to manage our mental health and well-being is to talk about it and to accept and recognize we need to look after ourselves, and we need to look after our minds, and we need to look after our brain function. We need to eat the right foods to build the brains of the young babies, you know, in their first 1,000 days. That's where their brains are developing, and that's where their future health will put down markers that will cause them to have health needs later. So if we're not nurturing, enabling, supporting people to think about health as a holistic aspect, which Sri Lanka is very good at, actually, isn't it? With the mindfulness practice, the environment you've got is stunning. Your country is stunning. So how do we utilize where we live, who we live with, to talk about things that will make us well and live long and prosper, as they say in Star Wars.
Okay, you're a Star Wars.
Well, my sons are,
Star Trek fan, rather.
Oh, is it Star Trek? Yeah.
Yes.
Well, that shows you I'm not.
Right. Another question which especially applies to Sri Lanka, but
Yes.
perhaps other nations as well, is the aging population.
Yes.
Now you referred to people living much longer.
Yes.
Because of advances in medical science,
Yes.
and also the general understanding of one's bodies and healthfulness and so on.
Yes.
So it's common for people to live, you know, not just up to about 70, but
Into 90s,
into their
isn't it?
80s
Yes.
and 90s.
Yes.
And this, I mean, that's wonderful, but it causes other issues in the population.
It does.
And Sri Lanka at the moment has a falling birth rate as
Yes.
well. So this has already led to a lopsidedness in the population, where our population on average is quite old.
Mm-hmm.
How does that affect the whole the work of health professionals?
Yeah. We're seeing very similar patterns elsewhere as well, not just in Sri Lanka, of longevity in the population. And in Norfolk, in the UK, in East Anglia, we've got one of the fastest growing older populations, almost matched to Japan. So we've got a lot of people on a lot of medication, living longer, with complex needs. But we're also seeing the healthcare workforce is also aging. So there's less people, like you say, because we're not birthing as many children coming through, choosing healthcare has become not necessarily one of the highest choices that people want for a career. So we're seeing an aging population in the workforce as well. So one of the things that we're trying to do with the conference is inspire people to be healthcare practitioners. It's an absolutely privileged role. I mean, look at me sat here now. That's because of my choice, and my nursing background has allowed me to travel the world and work in other countries, and has given me a perspective on global health that still fascinates me today. So I think we need to learn lessons from other countries, share what works. Again, we're doing that at this conference, and think about how do we take that knowledge forward in a coalition, because when you bring people together with a shared purpose, that's where the energy is, and that's where things really start to change.
Right, and also community infrastructure needs to change, transport systems,
Yes.
and also within a hospital, you will have more wards which would now be catering to older people and their ailments and
Yes,
so on. So you need to see a metamorphosis of this, don't you?
we do, and we also need to upskill and uplift our staff, because they are dealing with people with dementia, with mental capacity problems, so that when you ask them a question, they may not understand what you're asking and can get quite violent or get agitated, and so healthcare staff might be hit or they might be sworn at. And so how do we allow the staff to listen and to acknowledge the pain that people are in psychologically, physically, etc., and to try and understand their world and what it must be like? We had an example yesterday at the conference of the THEO program. It's called Therapeutic Optimization, and they were talking through how do you deal with an elderly patient who's agitated and is looking for their wife or partner who actually died several years ago, but because of their dementia, they're looking for them, they can't find them. So they get up, start shuffling, are at risk of falling over. So going back to what we were saying earlier, the quick fix, get them to sit down again. But you're not paying attention to the underlying issue. So by listening and saying, what does she look like? You must have had a lovely relationship. You worried about her, why? And being curious about what's going on for the person. And then you're more likely to be able to distract them to say, well, shall we go and find out what's happening? Come over here, let me get you a cup of tea. So it's a much softer interaction that allows the person to be heard, and then you find the right pathway of what they need in that moment.
And that would also be less stressful perhaps for the healthcare professional.
Indeed. So the impact of that sort of conversation with patients affects the workplace culture. So when you're in a workplace culture where you feel supported, enabled, and you know that your team are around you, your stress immediately reduces. So you're more attentive and you're more likely to interact in a way that promotes compassion and effective, safe, effective practice.
Now, what about when an area is faced with an emergency? You mentioned that some of the participants in the conference are from the Caribbean,
Yes.
Trinidad and Tobago, and
Yes.
perhaps Jamaica as well.
Where the
Now,
hurricane
yes,
is.
now Jamaica just got hit by
Yes.
the most severe storm,
Yes.
Hurricane Melissa, the most severe storm of this year,
Yes.
and the biggest one to ever hit Jamaica. And through this, medical professionals have to be working, have to be at their stations dealing with the injured and so on. I can't imagine the amount of stress that they are under.
It's very hard, isn't it, to know how to respond to people that have lost their homes, lost family members even, as a result of the climate, the severe weather we're having through climate change. And again, one of the projects we did in the Caribbean with University of West Indies in Trinidad and Tobago was an MSc in trauma and trauma management and mental health. So we worked with stakeholders to find out what are the community assets, because when you're stretched, like I said, you need to be creative and find where the resources are. And so we brought stakeholders together over a series of a couple of days, and we co-created a curriculum about what is available. How do we match that availability with student experience? And then what are some of the theories? What's some of the trauma-informed approaches that we can weave into the curriculum so that the workforce feel as prepared as they can be for dealing with extreme vulnerable conditions for whole populations, whole countries in Jamaica's, the example that we're using.
Do you feel that the healthcare professionals of the world are recognized enough? Because there was a time when you become a doctor and that is so respected, but has that sort of eroded over the years, or in this digital age?
Being diplomatic, yes. I mean,
it is so with many professions.
Absolutely. And I think public sector workers often have a difficult time finding their place in being respected for the knowledge, the value and the contribution they bring. And I suppose that takes us right back to what we were saying earlier. When resources are stretched, who gets cut first? It's the people that you think, right, we've got so many nurses in the hospital, they're getting a large chunk of our salary, economics, our payments. So can we shave a bit off here? Can we shave? So it's how do we understand what's value? What does value mean? It's not necessarily just economic terms. Value and contribution can be found in so many other ways. And if you look at the research about nurses, say, it's not the money. That's not why they do the job. It's the absolute privilege of working alongside people at their hour of need and seeing the healing process take place. That you can't pay for that, can you? You can't buy that.
Absolutely.
And that's why we do the job we do, because we want to work with and amongst the people that we want to serve and we want to care for.
Right. And we are almost out of time, but my final question is, when the pandemic hit,
yes,
and it was terrible for the whole world. We hadn't had a pandemic in decades. So it was difficult for every nation to deal with.
Yes.
countries, well, some did better than others, but we were all trying to feel our way. Governments didn't know what to do, close airports, close ports,
Schools.
have local curfews and things like that. I mean, here in Sri Lanka, we had a nationwide curfew for so long. And through it all, the healthcare workers were bearing the brunt of it, and they were there, and they were most at risk, obviously, because they're dealing with the patients. And in the initial stages, there weren't enough masks, and no one knew whether a mask would protect you. I mean, that must have been an enormous stress on healthcare professionals.
And we're still bearing the brunt of it, I think. And I think a lot of practitioners lost colleagues, lost family members, but like you say, kept coming back to work, wanted to deliver the best care they could. But I think we were all learning, weren't we? It was an unknown phenomena for a very long time. What sort of virus is it? Is it airborne? Is it, how is it transmitted? We were learning as we were going along. So I think one of the lessons again of a conference like ours is, how do we share the learning? How do we make sure we're not reinventing the wheel constantly in this country, with this profession, with this professional group, with this population? How do we pull that knowledge base so that we are all able to make the best decisions we can based on the best evidence? That's what I think we're trying to do with the Soften conference, is when we come together, that's where strength and the ability to change things for good is more likely to happen. It's almost where magic happens, when you get like-minded people together, sharing a vision, sharing purpose, sharing best practice. Then you get a ripple effect, and people are inspired to work in healthcare and support their populations.
Excellent, and I'm afraid we are out of time. My thanks to Professor Sally Hardy, who is the Dean of the School of Health Sciences at the University of East Anglia, and the chairperson of Soften, which is a conference that is going on right now on shaping our future through new coalitions. Thank you very much for being with us this evening. And thank you to you at home for watching. Don't go away, because the news is coming up next. Have a great evening.